I've been feeling vibes all day. I've been feeling vibes all night. Let me breathe and meditate. Elevate, is that alright? Energy. Vibes, 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 energy. Vibes, 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 energy. Vibes, 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 energy.
Hey, what's going on? It's your girl T Hardaway.
And it's Michael Basil.
Yeah, and we are the Did It for the Hood podcast.
Indeed.
Coming back one more time, we love you, we miss you, and as per usual, we're bringing you another phenomenal guest with some great information. This woman is the CEO of Helping Hands Warming Hearts Enterprises. It is a, I want to get it right, non-medical home care agency, correct?
It's a home health agency.
Home health agency,
So we
my apologies.
upgraded from home care to home health. Yes.
All righty. See, you already heard her in the background, all right? So y'all give it up to the CEO, Miss Candice Ray. How are you today?
I'm good. How are you?
I cannot complain. So thank you for taking our time to speak with us today. We're going to dig into your background a little bit and let you educate us on your industry and everything and how you got to becoming the CEO. But we want to kick it off and start it off with tell us your story.
So I started my healthcare career at the age of 16. I worked at a skilled nursing facility, and for the last 25 years, I've stayed in that industry. I've worked with insurance companies, hospitals. I was an IT consultant for 10 years. So I built clinical systems for physicians and nurses. So even though I'm not a clinician, I'm very aware of how workflows are because I made sure they knew how to chart properly in the system. Seeing everything I could possibly see in healthcare besides actually operating on someone. So I always said I felt like I understood the big picture of healthcare. I noticed that there were some times that I feel like we still operate in a silo. So I wanted to be that solution-driven provider to start connecting people. So when people ask me specifically what I do, I tell them I'm a continuity of care provider.
Continuity of care. Break that down.
How about to say?
Yeah, I can break that down. So you introduced me as far as the home health side. So we have an array of services. So the enterprise is a company of 4 companies and a nonprofit. So we do home health services. We do home delivered meals, so our medically tailored meals for seniors and those with intellectual disabilities and children. We also do non-emergent transportation. I have an occupational training center. So what I do is physicals, DOT and non-DOT for employers and anybody who represent DOT, which is Department of Transportation. So truckers, airlines, things of that nature. And our nonprofit is called Socially Healthy. So it's a it's a nonprofit that encompasses all of our services, and we focus on social determinants in Black and Brown areas. So we focus on making sure people are aging in place at home. So the real care happens after the transition from the hospital, and we make sure we keep everything together. So that's how the continuity of care. So everyone is not operating a silo. We're educated on everything that person needs.
Y'all are basically vertically integrated.
Correct.
Got you. So this is a very, no pun intended, enterprising endeavor. What made you want to expand so wide?
Because I felt like there was a disconnect. With me being in IT, I am a big workflow driven person. I look at things to make sure if things have to be connected, and if there's a breakdown in a workflow, it breaks down something else. I also have a background in Six Sigma. So I look at workflows, I look at people, I look at things and say, okay, what is adding value to what we're doing, or what is waste and what can we eliminate? And as much as we are advanced in healthcare in the United States, we are behind in a lot of things. So I saw gaps and I felt like, okay, if I'm taking care of a loved one, I don't want to have to talk to 4 or 5 different companies. You know why? Because I'm not going to get the same empathy for all of them. I may get a provider for DME that, that's, energetic, shows the empathy, may get someone else with a different, attitude. And when you're dealing with someone that's sick, you really need all the support that you can. So I have a staff that is fully trained to be able to take care of a lot of those ailments that people typically have to deal with. And even myself, I had to deal with it personally in my life with my loved ones.
Okay. And that was actually about to be my next question. I was going to say, what's the personal connection here? Because there has to be one.
Yeah. So I have a bachelor's degree in healthcare administration, a master's in healthcare informatics, and even navigating the healthcare system has been challenging to me with being in the field for a very long time. I've seen a lot of disparities. I've seen people that had PPO plans, or what we call the Cadillac plans of healthcare, get treated differently than people that may have had Medicaid insurance. So just that level of disparity was a problem that I saw. And there wasn't really anything at that time that I can do about that. I had a grandmother that had an illness that took the family to come together as a village to take care of her before her passing. Well, a lot of people don't have family caregivers or family dynamics. So what happens to the people that don't have that? Who's advocating for them? Who in their family, know enough about healthcare to speak up, about different type of care that they're getting to escalate things? Because a lot of times we just think, okay, it's the doctors and nurses, they know what they're talking about. And I've seen plenty of times when that was not true. So I wanted to create something that I became the voice for people, for those who felt like they didn't have one. And that's the birth of Helping Hands, Warm Hearts.
First of all, thank you.
Amazing.
No problem.
Amazing.
I just feel like you don't hear, well, at least on my end, because I mean, same, like I've had family that have been in and out of just healthcare facilities. So just understanding the fact that there is not a lot of empathy versus when there is in the space, like that transforms a person's mindset to what they even just think about getting further healthcare in general.
Correct.
And so, I thank you. Hats off to everything you do, for real.
Thank you. Thank you so much.
Sure.
So, did young Candice see this as a career path, or when did the light go off for you?
So when I was younger, my mom always took me to Bring Your Daughter to Work Day. I think it was changed to Bring Your Child to Work Day for, everybody. And she's always worked in healthcare. So I always say I'm a product of my environment. That's what I saw. I saw her work 2 jobs, sometimes 3, always related to healthcare, whether that's a patient care clerk. She taught medical coding, billing, things of that nature. So I enjoyed it. Even though I didn't know a lot about what she actually was doing, I felt like she had an important job. Even at that time, she wasn't in any leadership positions, but she took pride in the work that she did. She was good at what she did, and people, enjoyed her, and they enjoyed seeing me because they saw a lot of me and her at a very young age. So I think I've always had that work ethic. I also thought about being an attorney because my mom would tell me I always have a lot to say. But, once I fell in love with healthcare at 16, and, I've been learning a lot on this journey. It's amazing. It's something new all the time. Some new good things, some new bad things, but you never get bored because it's always work that needs to be done.
It sounds like it.
Yeah.
When you started naming off everything, I got tired. I said, oh no.
Listen.
Trust me.
Talking about, like you said, 10 years on the IT side of healthcare as well?
Yes, I traveled across. So I was a 10-year consultant, but I did IT for 13 years. I traveled across the US. Yep.
So your systems must be impeccable.
You know what? They are pretty good, but guess what? I think we get lax sometimes, So I'm a big stickler on SOPs. I'm a big stickler on, like we just have to really make sure these things that we're doing actually make sense. I am a stickler of waste. I'm not a status quo type of woman. I don't want to hear this is how we always done it. If there's no real rationale about we're doing it, we need to think something different. And I'm an innovator. So just because we've done something one way doesn't mean we can't change. And I empower my team to be leaders. When I was in grad school, one of my professors said that he thinks one of the biggest challenges of management, why they can't retain staff, is because they don't know how to manage up and coming leaders. It's a difference, and that's what I pour into my team. I care about transparency and accountability. You don't always have to know the answer. You don't always have to know the answer right now, but you have to be able to find it. And you have to be honest about saying, I don't know it right now, but give me a moment and I can go find it. how can you ever fault someone for being honest and actually knowing it's just time to execute and get the answer?
You know what's so
That's
funny
so
about you
heavy.
saying that? Yeah, that is heavy. But I was gonna say, you know what's so funny about what you said? That is true. People don't know how to manage up and coming leaders, and they don't know how to manage people that can think for themselves. And I
That's
always
it.
give people an example of, y'all ever seen the movie Hidden Figures?
Yes.
Yeah.
Kevin Costner's character. Am I saying the right person? Kevin Costner. When he had to manage all the
Uh,
engineers,
Mm-hmm.
mm-hmm.
that's how you manage brilliant people. You give them resources, you get out the way. But a lot of people aren't secure enough to do that.
No, they're not. And I think you have to also give them the tools, because I tell my staff all the time,
Mhm.
if you're the front line staff, the decision that you make, you have to deal with it before I do. So I'm going to give you the power to make that a decision because it impacts you. You know, if you feel like it was a great decision, that's positive reinforcement. If you feel like it wasn't, it's negative. But guess what? You have to deal with that, but you always have the ability to fix it. It's not much in healthcare that we can't fix.
Mhm.
But we just need to be rational about the decisions we're making. And in my line of business, we always talk about patient safety and huge financial impact. Those are
Mhm.
things that are not up for negotiation. So we always
Mhm.
keep that in mind when we're making our decision.
100%, 100%.
Question.
Yes.
So those two things that you just said, can you say them one more time?
Oh, for as far as my industry, so we have to
Yeah.
make sure that we never compromise on patient safety and financial impact.
Patient
So
safety and financial. Yeah.
yes. So we have to look at
So
our cost analysis. Like, is this good for the brand? Is this good for the company? As far as, if we had a contract that we were supposed to sign and we didn't send it back, we can lose our whole contract, which means we lose revenue. So we have to keep up on our
that part.
paperwork. And
That
with
part.
anything that we do, we have to put the patient first. So we have to make sure these are not just decisions to make us comfortable. Do they have any type of risk mitigation as it relates to patient safety? Those are always our top priorities.
I love that. So do you feel like those are like the top problems to solve in your industry, or like what do you feel like are the top problems that you are determined to solve with you and your company?
Advocacy is our top problem right now.
Mhm.
Mm,
We are in a different climate of healthcare. To be honest, it's quite embarrassing what we are doing right now in the United States as far as how we provide care.
yeah.
We have people making decisions that are really not boots on the ground. So there's no real logic of how this impacts people. One quick example is going to be just the changes in Medicaid. People, unfortunately, I always use the word ignorance in a way of the fear of the unknown, because sometimes you just don't know, but you
Mhm.
need to educate yourself. So there's conversations about, oh, hey, Medicaid cuts is not going to affect people that have insurance because they have private insurance. Well, that's not true, because guess what? Those same doctors are Medicaid providers. And a lot of times those dollars are keeping them afloat, number one. Number two, you're going to have more people going to the ED and going to these hospitals uninsured. Who are they passing those healthcare costs to? The people that actually are
Oh,
paying the premiums.
exactly.
So, we're getting misled information. We have people making decisions that are not actually in the communities and are not really educated to even make the decisions. I mean, let's just be clear. But unfortunately, this is where we are. So we have to kind of adapt with what we're doing. But I feel like this is more about advocacy more than it's ever been before. And most people don't realize that you don't have to be a political figure or deemed or have a title of an advocate to be an advocate. You just need to actually speak your mind and correct somebody when they're saying something wrong, because 20 people may have went with that story and thought, oh, I don't have to worry about it, but you do have to worry about it. So advocacy just could be in day-to-day conversations, just actually enlightening yourself and willing to learn more information.
So for a person that
Say.
wants to learn more about what's going on in the healthcare industry and they want to educate themselves, what would you say is probably the first step for them to like educate themselves?
Um, I would say read. I mean, we are in a situation. We are in a world that we do have a lot of information at our fingertips. I mean, half these kids don't know what an encyclopedia is. They've never been to a library. So there's a lot of information that's there at our fingertips. And then I feel like if you are truly intrigued in what you're talking about, Google or research thought leaders in that industry,
Mm.
right? And see and kind of compare notes. People have opinions due to also socioeconomic status, sometimes their political party, but some things are facts, you know. So I think if you truly are, you know, interested, even if you're watching the news, well, how about fact check maybe something that you heard if you're really interested in it. Just don't think because it's on a large syndicated television show is actually accurate. I think we got to kind of wake up a little bit and what I say, stay woke, because we're getting pushed narratives that are just extremely just not true. And I can't believe sometimes we're this gullible as Americans.
You ain't gotta tell me. I be double checking
Okay.
everything I see online. I'm like, that don't sound right.
That don't sound right.
You know,
That sounds a little questionable.
listen, you just
Okay,
know it
so
intuitively.
Yeah.
yeah, and also if somebody's speaking with passion, people are susceptible to believe.
Yes.
Hmm.
Yes.
Okay. So let me pivot into your business. So you talked about some of the changes and things that were happening in healthcare, and you talked about, some of the mistakes that staff can possibly make and the things they have to live with. What are some things that you've had to pivot through in your business, some changes, or any of those things that you've had to work through in your business?
Yeah, I think my largest pivot was January of 2025. I received a call from a major payer that I'm contracted with to basically give me a 90-day heads up that I'm going to lose almost $2 million in funding. So
Mm.
it's not that much. And when I say funding, is reimbursement rates, not like a grant or anything like that.
Mhm.
It's not much pivoting you can do with that short notice to almost try to bring in $2 million.
Hold on one second. When you say reimbursement rates, are you saying services rendered, money you're getting for the services already been
Correct.
rendered?
I
Okay,
literally lost 50% of my budget for what the services that I was providing. This is
got it.
specifically for my home delivered meals product because I'm a believer in food is medicine. You know, we want to have great healthy food. I support local Black farmers. You know, I made that part of my corporate structure to not give all my money to these lawyers that provide food, but to kind of keep that money locally to create workforce development. All so I had to make some tough decisions there. I knew I was never going to compromise my quality with a quantity because that's how I got my name in that side of my business. So there was some restructuring with menus that we had to do. We had to look at the finances, and then we actually had to make the decision: was it the best interest to keep this in-house or outsource it because I still need to scale to grow the business?
Mm.
And I think people may look at outsourcing or laying your staff off as a failure, but sometimes you have to do that if you're playing a long-term game for sustainability, because we need money to scale. That's why a lot of times our businesses just don't grow. So I made that decision. My staff was really understanding of it because I kept them educated and on what was going on in the climate of healthcare. And I think that's the problem. We're not transparent enough, even with our staff. So sometimes they're hoodwinked, blindsided because we're not communicating, or we think, excuse me, they might not understand, but believe it or not, they will. So it was a hard thing to do. I was very upset. I felt like a failure. I'm gonna be honest with you because I couldn't make that up that quickly. But I was still able to still put out my 45,000 meals a month. And even with that pivot, it allowed me to look at my scope even larger. So I ended up opening in 3 other cities outside of Philadelphia.
Setback for a
Wow.
comeback.
Yes.
Exactly. That's
Yeah.
my favorite.
That's what we love to hear around here.
Okay. That part.
So during that time period, or even during any period of the course of your journey, did you ever want to quit this? Like, did you ever feel like giving up on this?
Um, I did, and I would be honest with you. It has been more recent than ever. Just because of some of the things that I mentioned. I'm like, okay, I'm fighting for my people. I'm fighting for my company. Maybe I need to take my talents in another country that, believe in healthcare the way I do, because I'm gonna be honest with you, this is all I ever knew. So I
Mhm.
believe in we care about quality of care and a lot of things that we should stand for. Everybody should have universal healthcare. I'm a believer of that. But once
Yes.
you're actually in the weeds of it, you understand everything, how insurance works, risk mitigation, just reimbursement, you realize healthcare is a big business. And as I've grew in my career, I've noticed how private equity firms have entered into healthcare, and it has changed the climate because people have chosen profit over care. So I would say around this time, I thought about sometimes like, hey, I get offers all the time for people to want to buy the company, right? I never entertain it because I feel like I haven't reached where I need to be to even value my company appropriately. But these days I'm like, hey, you know what? You always grow something to be sold, like you want something that somebody wants to buy. But I said, well, my story is still, I still have so many chapters left. So I would be doing my community a disservice and myself to give up right now. I just got to go even harder. I always tell people when you're back against the wall, you double down on the investment. So that's what I'm doing right now.
That's what I'm talking about. I'll turn up.
Do you feel me? Yeah. And so like if outside of just of course like self-determination, like also like as far as leaning on community, like what does that look like for you even when you are in these low moments?
So I'm a big person and a believer of mindset. You have to have the right people around you. Being an entrepreneur is truly being a part of the 1%. This is not easy. It's not something that everybody's going to understand. It gets a little lonely at the top because you have different level of conversations. Some people would be like, oh, I would have shut down if I lost almost 2 million, but not come to the table to try to figure out solution. I'm a solution driven person. We're not talking about the problem too many times. We're not, because I need to push the needle forward. So for me, a lot of my social groups that I'm a part of, I was very intentional about always being around people that were technically doing better than me, people that may have been on my same wavelength, people in different industries, because whether you're real estate, construction, healthcare, it's still a business and it's still foundation things that's going to always be the same. So I think my actual circle helped me out, a lot during the times that I felt like I had nobody else. And I was very intentional about those memberships because I knew things were going to change and I knew things were going to probably get tighter. So I needed my circle to be even tighter. So I'm very strategic about where I spend my time. I miss a lot of birthday parties, but I'm the auntie to send the gifts. But sometimes I gotta go, and fly somewhere to a conference with like-minded people so I can come back and get that knowledge and pour it back into my team. So I'm just focusing more on alignment of how I spend my time.
I need to get my life together. That's what I just heard. You need to reorganize your friends. Hey, man.
Okay.
Together. You interviewing me, so what that tell you?
Hey,
I'm in the right rooms. I'm in the right.
You pushing the needle forward. You giving me the questions. I'm not the boss anymore.
You're always the boss, but we always students of the game. So that's one of the reasons why we love doing this, because we're more so interested in you giving the master class to the people. So that's why we're here. Want to listen more than anything. So over the course of your career, what has been your biggest lesson thus far?
It's okay to fail. I think, we're in a world that people want to brag about the great times, but it's really those failures when you learn the biggest lessons.
That's right.
It's just all about getting back up. Like I felt more than I win. I tell people that all the time, but it made me stay resilient. It made me keep going. It made me think sharper because I am a believer of power in the pivot. Like we gotta just keep going. We have to just figure out a way to work it. And instead of looking at the obstacle, looking at the opportunity in it. Like, what did I learn? What new idea did I think about? It forced me to think outside of the box because a lot of times we're just streamlined of what we know. So I just think that failure and being okay with it, I've learned that over the years. I wouldn't have been able to tell you that answer 3 years ago because I would have just been like, I can't fail, or I feel like a failure. But now when I fail, I have to say, okay, what did I learn in this? What could I have done better? What red flags did I miss? And what systems can I put in place or the right team to make sure this doesn't happen again on that same magnitude? But guess what? The failures happen again, but they happen on a bigger level. but
Mhm.
typically that bigger win is coming. So as long as you're learning from that and keep going, that's all that matters. Because if you're ready to quit, you got to put years into this thing. If you want to quit when you fail, you're not built to do it.
Hmm.
It's a bar.
Okay, about to say you can say that one louder for the people in
Yeah,
the
if you want to
back.
quit, you really have to put a lot of time. And this whole concept of instant gratification is just not real. You have to be willing to go broke, work 10, 15, 18 hours a day for a dream that nobody else see but you.
Mm.
But guess what? That's why you're part of that 1% club, so it's not for everybody.
Hmm.
I
But
always
once you
talk
accept
about,
it, you're good.
for sure. I always use Steve Jobs as an example, just because he came up with the computer. I mean, the Apple computer, whatever. I was like, if you could think about somebody telling you that at some point a cell phone will fit in your pocket and you'll be able to look at people and talk and the internet will be on it. Back in the day, they thought that man was nuts.
That was nuts.
That was
Yep.
crazy.
But he kept going. He had something in him that he knew that this was going to work. But he
Hmm.
kept going because you're going to get that yes at some point,
Hmm.
especially if
Yeah.
you want to play a long-term game. And one thing about this field is not instant gratification. It's not
Hmm.
going to get rich. I'm not going to write an ebook that's going to sell 5 million. It's not set up to do that. So you have to have some type of empathy and passion for this because the actual job and day-to-day will let you down sometimes. So you need that dream to keep you up. That's the only
Yeah.
thing you're going to have to hold on to at some point.
Well, I don't want to Debbie Downer this. What's one of the most fondest memories that you have thus far in your career?
Um, I think the staff and the clients that I see, like, I know I'm touching a lot of lives. Like, I have over 1,000 food clients that I feed. I'm putting out 35 to 45,000 meals a month. So my gratification and what I love is the people that I'm reaching.
Mm.
I'm able to expand in different counties. I have 132, 42 employees. So I'm providing employment and job force development and leadership skills to a nice amount of people that I just wanted to keep growing. So I think my reach is what I'm more proud about. Everything else, the finances, the part, all that stuff will come later. But just being able to have somebody to believe in something that I have and constantly see that grow. It all started with the idea on the whiteboard, and I'm living it. So I'm
Hmm.
blessed for that.
And being of service too.
Yeah, like to
Absolutely.
know that you're touching these people and you're training your staff to somewhat think like you because that's part of your core values. So it's like, okay, well, it's like the trainer type of model. Like, making sure that you're actually teaching more people because the goal is to have more Candices or find a community of more Candices and people that think better than me so we can really do more great work in the community. So it's just that level of service and seeing how far your reach can be is to me my proudest moment.
Mm.
Beautiful.
I started off as a young girl from North Philadelphia, in one office, one business, and just to see the growth of it now, looking at different cities and different states, done some community outreach in Zanzibar from a global level. So, I know my mission is bigger than just this country. I do want to have a global impact.
You answered the question I was about to ask. I was about to say, where
Yeah.
did this start? And then you said one office. Okay. What was the first service that you offered?
I'm sorry.
I
Yeah.
said,
I think
what
your
was
thing
the first
froze.
service
I
that you
couldn't hear you.
offered?
I think it's home care. So that was the non-medical care. That was the first service that I offered. And then we branched off because I had relationship with nurses and physicians. You have to have physicians on your board to do the nursing side. I have a family of nurses. So I knew that I wanted to do more services because I knew I wanted to be a solution-driven provider for people. And I'm the big whiteboard person. So I write everything on whiteboards. They're all over my office, all over my house. And I would just check it off. And then if it was something I couldn't check off, I'm walking by that whiteboard every day. I'm like, I'm not accomplishing my goals. I got to get to it.
Right.
So that level of accountability, that's the mirror that I feel like some people are like, they don't want to look at. sometimes if you write those goals down, you're looking over at them and it's 2 years going by, but you have to sit and say, what did I do to try to cross that off? What am I doing with my time every day?
Mhm.
I gotta do
We just
better.
need more people like you in this world, Miss Candice.
Yes.
That's all I'm gonna say. Like for
Yes.
real.
No,
Let me
I'm a
ask
big
you.
believer of people, places, and things. It's like, what are you spending your time on? My coach always
Yeah.
tell me like the average of the 5 people you talk to the most. So if they talking about what's going on in the blogs and being broke and this and that, you become that mindset. Like that becomes
Yeah.
a broken mindset. If you're talking about winning and all of these other things that may be bigger than what we are used to talking about every day, at
Yeah.
some point you start living and breathing that talk because it's energetic,
Yes.
it's making
Yeah.
you think about something new, and you
Mhm.
want to, you want change. Status
That's
quo
right.
is dead. We have to want change.
That part.
Very true. Very true. So, oh, your mother, I was going to ask your mom, your mother's still with us?
Yes, yep.
What does she think about all this that you've been doing?
It's funny. She's my biggest cheerleader. I'm my mom's only child, so it's always been, it's been us from that's my ride or die. Unfortunately, we lost my dad to ALS last year.
Condolences.
So it's really just us now, and I work hard to take care of her. Like, I gotta retire her in 2 years, so I got some work to do.
That's
But I tell her, I was like, she taught me the game. She showed me what a good work ethic was. She exposed me to great education from private and Catholic school. Like I said, she just taught me to be honest and be truthful, and not expect any handouts, but always be vocal. She
mm,
always said that if they don't listen to your voice, you talk with your feet, you leave the room. You don't have to, you just exit, go where you are welcome. And
yeah,
I feel like I've lived that every day of my life. And it's worked for me because I'm not coming in rooms trying to shrink myself. I'm not coming in rooms like a giant either. I'm just coming in rooms as myself and knowing my worth and knowing what I'm passionate about. And that resonates with when I talk to people.
I got a question based on what you just
Mhm.
said. So, have you ever gone into a space being your full self and an opportunity closed on you?
Um, yes, I have. And that was actually at my younger age, because they thought I was too young for the job.
Wow.
And they actually called the reference for another job. And that's what let me know, okay, I have something special, but people are questioning my gift.
Mm-hmm.
And,
Mm-hmm.
Oof.
I also feel like it's not
Mhm.
always the same playing field for people that look like me and you.
Mm-hmm.
So I think if it was a different dynamic, that wouldn't have been something to question. But that just let me know I had to work even harder. I had to show, even if I had resume, I was still other things I needed to stand out.
Yeah.
If my age and my ethnic background or things were going to be something that would hinder me, like why are we just not leading with the work and the
Yeah.
referral? So I knew I had to always have my suits. Like, like I didn't really believe in dress down day like that because I just felt like it was just certain things that I had to do. If I had a master's degree, I had to go get 3 other certificates. It was just things that we just constantly have because the goalpost changes a lot of times. If we don't realize that, we're going to be left behind.
Yeah.
So that
Mm.
happened at a very young age, and it just made me transform and know how I needed to navigate in this climate now.
Okay. So, opposite of that question, have there been any time when you being your full self opened an opportunity for you?
Yes. So when I opened my food business, I went after a large contract, a large partnership with a large healthcare organization, like a renowned pediatric healthcare company.
Mhm.
And they never did medically tailored meals for children. And my thought process was, well, if the government pays me to make meals for seniors that have diabetes and things like that nature, why can't we really do preventative health and start teaching children how to eat healthier so they don't grow up to be seniors with diabetes? Like it's very simple in my head, right? So I I'm looking at the area. So I'm in the Philadelphia area at the time. I'm still here, but that was my first part. And I said, okay, let me go look up this hospital and what do they think about healthy weight initiatives. And it was 3 o'clock in the morning. Now, what are their website? I had a family member that worked there. I'm like, hey, I need a name of somebody in leadership in this department. I want to pitch them something. And I pitched them a proposal, and we worked on it for a year. And we were the first to ever provide medically tailored meals for people that suffer from the food insecurity. And my company was 17 months old. So I asked the woman, I said, why did you pick me? She said, because we talk about community partners and you come from the community that we're serving, and the passion in your voice, there was nobody else experience that can touch that. Mm-hmm. That's why I gave it to you. And now we have about 3 more initiatives. It's been 3 years since that happened. And I still have a relationship with that person now. And they gave me my first start. And now I've been just running with it. But I came as my authentic self. You know, my kitchen wasn't the largest kitchen in the city. You know, I didn't have a long resume of actually doing that. But what I had was enough to seal the deal. So I just came as myself. And I tell people, don't come in as anything other than that, because people can see the difference.
Mm-hmm. They can smell the fake.
Yeah, they can smell it.
Yep. That is so true. That is so true.
Well, speaking more.
Oh, sorry. Do you teach?
Oh,
I'm sorry.
I would just. You good. You good.
No, I don't teach. I mentor people. Just people that I feel like are younger me's, or people that I see something in. You know, it's not like an official program, but if they show interest in what I'm doing or to learn from me, I'll definitely do that. I've done some webinars and just showing people how to expand their business. So I call it stack and serve. So I literally stack my services up to serve the same community and more. So I also just give people a mindset to think about adding additional revenue streams to what they're already doing. Because sometimes I think you just need to think big picture and think about, well, if you think of my model, if I have one client, I can provide 4 different services for them. So when I'm starting my business, my marketing budget is very small because I'm making money day one, because they've already trusted me with one thing. They've trusted me with all those other things that they qualify for it. So starting those companies, I'm not putting up as much upfront cost of marketing because the trust was already there with the first brand.
You've already proven yourself.
Correct. Past performance means everything.
Yep. I was just reading I'm reading a book right now about service businesses and how it's more relational than selling product.
Yes.
Yep. I'm reading right now. Well, if there was anyone that wanted to do what you're doing now, what piece of advice would you give them?
I would say keep dreaming and think big. A lot of times it's going to be some lonely times, but if you have something in your stomach, your heart, that you can't stop thinking about, or you're so intrigued about, typically that's the thing you should go after. You know, we come from environments that sometimes people don't think the best. You know, they may say, oh, that's not possible for you. You can't do that. Typically, those are the goals I go after first, because I have something to prove for myself and I have something to prove to the naysayers, and not to be like, oh, I told you so, but just to show you to go for it. Because if I can do it, you can do it too. So I've just always been that girl. My mom used to laugh and say I had champagne taste with bare pockets when I was like 4 or 5 years old, you know, and because I've always wanted great things and just wanted to live a good life, and bring everybody with me. You know, I was the only child, so it would be the block party. It would be all of the people I want to take to Chuck E. Cheese, you know, so community has been instilled in me for a very long time. It's just now I just turned it into a business. But I just feel like also from a community impact standpoint, I come from that same community that I'm servicing. So my goal is to show you I can come from where you come from and still do something great, but never forgot where I came from, because I'm coming back to try to fix the problems that I already knew was there. So that community impact means a lot to me than some other people, because they might be like, oh, I just want to help underserved people. But if you don't really come from that or outside of helping them, a lot of times we don't make it out. They don't think I grew up in North Philadelphia. They think and I'm like, no, my environment actually made me feel comfortable at 19 years old to work with physicians. Because we're from an urban area. We got to defend ourselves. We have to be vocal, and I was just taught, he's no different than me. He put his pants on one leg at a time, just like me. The white coat doesn't, intimidate me. But because we come from an environment that we're not easily smitten or intimidated, we have to be strong. That kind of resonates in your work-life balance, and how you carry yourself. So for me, it was like, okay, I want you to see this girl from North Philadelphia can do it. So can you. It's just about how bad do you want it.
That's real. And also when you maintain who you are, the integrity of who you are, it makes others respect you.
Correct. Yes.
100%. 100%. Candice, you pouring into the cup. The cup is full right now.
I know.
My cup is full. What type of legacy do you want to leave behind?
I want to be thought about as a woman that went for it, very resilient, but was a voice for people who didn't have a voice. I think sometimes when we tend to elevate and we grow, we sometimes forget about the little people. As little people, I'm not talking about just our friends. I'm talking about the reason why we started. Because that shouldn't really change. It should just really change how we execute the mission while we started. We may do other things, we may engage in the real estate, but guess what? I could still do senior living real estate, assistant living, like the passion's still there. It just I might pivot into different parts of it. So I just think the advocacy part is important, just being a voice and feeling empowered to speak up for others, not just based off of your own, personal satisfaction or gratitude, or, oh, this doesn't have anything to do with me, because it's really a us problem. It's not on the person, and we need to really understand all of these things are really connected. They're a domino effect. So when our community is good, our crime rate is down, our economy is good, our workforce development is great. All of these things are connected. So we really can't fail in one area and not think it's part of our job to try to fix it.
Word. Mike, you got any questions for Candice?
Yes. What does did it for the hood mean to you?
You beat me to it.
Okay, so did it for the hood means to me basically what I do every day is for the hood where I come from. I want people to see, like, I came from where you came from. I can put my suit on, and sometimes, when I'm preparing for meetings, it may be gospel music. Sometimes it's Jay-Z, because I love what I love based off of where I come from. But I think we need to stay true to where we come from and where we going, and understand that they don't have to be disconnected. If you truly are passionate about where you came from, but you may have seen things change over the years, you don't run from it. You become the change to make it better. Yeah. So to me, it is doing it for the hood. It is showing young Black girls and young guys that you can be entrepreneurs. You can start those conversations very early. Selling candy is concepts, like, things that we all do already that we need to show that is entrepreneurship. But also, let's not knock a 9-to-5, because my career financed my dream. If I didn't do IT, I wouldn't be able to handle the stuff that I handle, because I had so much responsibility in corporate. So we need to shift the narrative about that, because there's a lot of successful, CEOs that are not founders. They just are in these companies, and they're doing well, and things like that. So we just need to know that it's a possibility for all of us to make it out. It's just about how bad do you want it. And if you found there was a problem in your hood, it's probably your job to try to fix it.
I ain't touching that. That's a good way to end it. My name is T. Hardaway,
And I'm Michael Basil.
and this is the Did It for the Hood podcast.
Indeed.
See
Thank
y'all
you so
later.
much for having me.
Absolutely.
Yeah, 40 million in our bank, we want all of that. 200 million in the safe, we want all of that. $1 billion investments kept away, we want all of that. Black man with money in USA, get you hollered at, but we want all of that. 40 million in our bank, we want all of that. 200 million in the safe, we want all of that. $1 billion investments kept away, we want all of that. Black man with money in USA, get you hollered at. Yeah.